Hi, my name is April Schendel, and today we are going to be talking about accommodations for students with ADHD. I'm going to go ahead and share my screen and get going for us. Okay, so this presentation is for TEAL 859, Advanced, Diverse, and Exceptional Learners. So first and foremost, we should be talking about what is ADHD. It is a medical condition, and some of the things that would be consistent with an ADHD diagnosis would be chronic and serious inattentiveness, hyperactivity, or perhaps impulsivity. This has got to be more severe and frequent than in peers. So in order for there to be an actual medical diagnosis of this, there needs to be multiple symptoms, and it needs to be in 2 or more settings. So for instance, at school and also at home, or for some younger students, maybe at daycare and at home. And then this also would have to interfere with academic or social functioning. So you've probably heard about ADHD before, and that is because it is one of the most common childhood psychiatric disorders. There's over 6.4 million children in the United States who have been diagnosed with ADHD, and it is a little bit more common, actually far more common in boys than in girls. So it's about 2.5 boys who have been diagnosed with ADHD compared to 1 girl. And this other thing to keep in mind is that it does occur frequently with other disabilities. So for example, a student might have ADHD and another kind of learning disability, or perhaps autism, and then maybe they could also have some kind of emotional disability as well. So we're going to continue talking about what hyper ADHD is. It stands for Attention Deficit Hyperactivity Disorder. And there are many ways that the needs of students with ADHD can vary. For instance, they might have the inability to regulate their attention or to focus. Or they could have some failure to control executive functions. And so some examples of executive functions would be their working memory or their self-directed speech, their ability to kind of self-soothe and talk themselves down, or control of emotions and motivation, or even reconstitution, which is the ability to relay information or to relate information to perform various tasks. And some students are eligible for services through IDEA, but many receive assistance through Section 504, which is mostly to prevent discrimination. So there are 3 types of ADHD. The first would be predominantly inattentive. So these are students that might have a hard time following directions, especially if they're only stated and not written, or maybe skipping altogether, or just not noticing parts of assignments. These are students that might be losing things frequently, but these kids do not move more than their peers. The second type would be predominantly hyperactive, impulsive. So again, this is more than their peers would show these types of activities like acting before thinking, or fidgeting, or tapping, or squirming parts of their body in class. They might blurt out answers without raising their hands. And then the third type would be the students that have a combination of our other 2 types. So those would be students who have some characteristics of predominantly inattentive and predominantly hyperactive. So there are some interventions that we can use to help support our students with ADHD a little bit better. Some behavior interventions would be to emphasize structure and rewards. So you want to give these students specific verbal praise. If you've noticed that a student who's had a hard time blurting out answers before raising their hand, but then you notice that they did raise their hand to tell you an answer, then you're going to want to specifically praise that. You also might want to come up with some reward system or some kind of symbols of appropriate behavior. Stickers are common, or maybe some kind of point system. There are also some environmental support strategies that can be used. For instance, students with ADHD tend to perform better if they're sitting near the front of the classroom. You also want to make sure that wherever your students are sitting, especially those with ADHD, you want to make sure that area is as free from audio and visual distractions as possible. So for instance, you want to make sure that your classroom decorations are not going to be too busy or too distracting. You don't want anything hanging from the ceiling. You could also allow students to move from desk to desk, and then you might even let them have the choice to stand while they're working. And then another thing to keep in mind for a behavioral intervention would be to give clear, direct, and calm reprimands. So for instance, a student that might have had a hard time not blurting out answers, when they do that, make sure that you say to them, I need you to raise your hand before you answer my questions. There's also some parent education factors that we might want to consider, mostly because this element of having parent education is going to maximize the benefit of other interventions, which we will talk more about those, but some other interventions would be medication or even behavior therapy. In order to help parents in their education, we want to teach parents to have consistency. This way, the student can see that their behavior is being responded to in the same way at home and in school. Of course, parent education also is going to feed a line for collaboration for the students, parents, and for the school to be able to work together to best support those students. And then, of course, parent education is going to have a positive impact on the student functioning. So the better that we can all work together to support these students, the better it will be for them. So there is something that you want to keep in mind as the teacher and your role in providing parent education. Something that we can do is offer and also encourage parents to attend sessions that we can give them helpers and tips on how to help them support their students with ADHD. For instance, we want to encourage parents to also create a discipline system that has rewards and consequences. We can provide them with tips that can help them encourage their child to make friends or help them as far as collaboration with school professionals and for academic success. And then of course, parents can also benefit from learning about their children's rights after they graduate. Something that was mentioned in our textbook would be to also have some cultural considerations that you will want to keep in mind, that students of different backgrounds and in different cultural backgrounds, their parents and families might have different reactions or different levels of enthusiasm as far as participating in any help sessions. And so we want to make sure to explain those sessions to parents who might not have otherwise attended, and to also just really encourage them to attend. So there are some interventions that can be taken for students with ADHD to support them. One is going to be medication. Approximately 70% of children who have been diagnosed with ADHD are prescribed medication. Most commonly, these students are going to be between the ages of 9 and 12. And of those students that have been prescribed medication, it has been effective for about 70% of those students. But the best thing to do is to also combine medication with other interventions, such as behavioral therapy and parental education. So a little bit of note on medication. It is effective, but it can be controversial. There can be issues with dosage, making sure the child gets the right dosage and is taking it consistently. And in bad cases, sometimes they might be sharing with their peers. You could also see some side effects from medication, for instance, changes in weight. And then there was mention of there perhaps being an increase for potential drug use in the future and problems into adulthood when students take medication at an early age, but this was not supported by research. So there are 3 main types of medication that could be administered to students who have been diagnosed with ADHD. The 3 main types would be stimulants, antidepressants, and antihypertensives. So of stimulants, there are 4 main types: Ritalin, Cylert, Adderall and Focalin. Something that was pointed out in our textbook was that there is a high potential for abuse as far as Adderall is concerned. Antidepressants can be helpful as well. For instance, norpramin, tofenryl, and then Zoloft. And then there are some antihypertensives that have been used as well, such as clonidine, Tenex, and Strattera, which Strattera was the first non-stimulant ADHD medication that was approved by the FDA. So I had heard of Adderall and I had also heard of Strattera, but I wanted to get a little bit of extra research in, just wondering about the effectiveness of these drugs and which one might have been better. So I found a study, you can see it cited down here at the bottom of our slide, but their main takeaway was that the extended time course of action and the greater therapeutic efficacy of Max-XR suggests that it is more effective than amoxicillin in children with ADHD. So Max-XR would have been the long-release Adderall extended release, and apparently that was actually more effective than Strattera, which is atomoxetine. So medication and the role of the teacher. So obviously teachers cannot diagnose, nor can we actually administer medication, but we should be knowledgeable about what are the options for treatment for our students. If you know that a student is being medicated for ADHD, then you're going to want to keep an eye on that student to just be alert for any changes in behavior that could be a side effect, and you'll want to be able to alert the school nurse and or the parents. And then parents might have questions for us as teachers as far as wanting to know how this medication has been affecting their student or their child in school. So we need to be prepared to respond to questions about it as far as how is this medication seem to be doing for our student. And then there are some academic interventions for students with ADHD. So something that we should note is that there are some similarities between students with ADHD and also gifted students. However, some of the defining features of ADHD are not usually associated with giftedness. That information did come from one of our outside sources, so you can see that I've cited it there. And then also students with ADHD do share some characteristics with students that have emotional and behavioral disabilities, and so they'll benefit from a lot of the same interventions, like making sure you have a structured environment and providing clear instruction. And then sometimes they do struggle academically as well, but this can be varied. And also this struggling academically seems to be regardless of medication. So we will want to keep in mind the include strategy. And also in addition to that, we want to emphasize only essential information for these students. And you need to use some very, very clear language. It can also be helpful to break assignments into smaller parts. As far as reading comprehension, you want to make sure and take time to check for understanding and progress throughout the assignment. And you might also want to give these students extended periods of time to kind of help them process. When you are thinking about math instruction, our textbook recommended to keep the pace of instruction perky. And then a note on large group instruction would be to make sure that you have opportunities for participation and sharing, and also take time for students to be able to repeat answers as a class to kind of keep everybody on track. As far as families of children with ADHD, it was noted in our textbook that this can affect every area of family functioning, and that it adds significant stress for parents and siblings. And this can be at home and also interactions with school personnel or just in community settings in general. So here are my references outside of our textbook. I did have 2 outside sources. So thank you so much for listening today, and I hope that this presentation will be helpful for you.